Welcome back, everyone. I am Zach Shelley, and I have Kirk Teach out here with another awesome episode of Management Unfiltered. Kirk, I'm excited about this one. What are we talking about today, and why does it matter?
Okay, so today we're talking about why we struggle with associates and how I feel like there's this just like there's this tension between, the front and the back sometimes. I feel like there's also a tension of associates and owners, right? And or office managers, leadership in general, right? And it can be really great. We've had really great associateships in our practice. You have had really great associateships in the practice you've been in.
Yeah.
And I've seen it work really well, but I've also seen some nightmares and some things that I would not wish on anybody. So today, let's just kind of dive in on maybe some things that we've seen that like we see associates struggle from not only the associate side, but also the leadership side. And like from what I see and you see.
Yeah. So I think the first thing, I just want to blanket with this. The ADA puts out data every single year, and I'm not going to dive any deeper than that into ADA because of controversial issues. But with this, I do feel this data is pretty darn accurate. The average associateship in dentistry is about 18 months, which if you didn't know that, that is where all the data tilts and leans. And it's not just the ADA. There's a lot of other organizations that track these metrics and values. And why is that? Like, what are the big points of like why we struggle with associates? And I think one thing that I kind of always tend to go back on is one, why did the office bring in an associate and what was the goal? And I feel like a lot of practices actually just like, well, I want to get busier, but they actually don't have a good system or goal into it. And what I've heard from other associates that I was bringing on is like the other doctor just took all the big cases, gave me the leftovers, the existing patients they didn't want, not fed me what they really should be. And that's where I feel like one of our biggest reasons we struggle is we're not setting up this associate for success because we're selfish on the back end.
Yeah, and it's tough. Like from the owner's perspective, it is tough to think, okay, I'm bringing somebody in, I'm so busy. Then you're like, oh, but wait, I could get paid $500 on that crown versus paying somebody else to do it and making $100. So like it's hard to let go of that control. But I will say that once you flip that switch to feed the associate first, then they're happy. Now, one of the problems that you do run into and that we have run into in the past is like the associate changing treatment plans to where it's like it's not a clear defined parameter, right? Do I think, you should dictate what another doctor thinks? Not necessarily, but I would say that there are standards to a practice. Like I feel like that really needs to be laid out. They're like, hey, here are the standards. Just like with hygienists, there's no difference, right? It's like, hey, with hygiene, here's the perio protocol,
Yeah.
right? And here's the standard of the office. If this is what it is, then it's perio. And as long as it's within, the scope of what it's supposed to be, then that's okay, right? And you can have a higher standard, but definitely don't have a lower standard.
Yes.
But I think that's the same thing we need to do with associates, right? So to convey the standard of the practice with all the procedures that you're doing, right? Because some people are more proactive. Some people are more conservative and watch.
Yeah.
Some people are just neglecting. Yeah. So I think it's important to have that standard set and you just communicate that across the board and really communicate different treatment planning styles, right? So to just saying, especially if you're the owner and you've obviously built the relationships and you've done a really good job of successfully closing treatment with the flow of the team, then you need to sit down and really think about how do you actually treatment plan and what does that workflow look like in hygiene in that exam?
I think too, just before you get too deep into this, Kirk, When Kirk's talking about this, my opinion is when you're looking for the ideal candidate and you're going through interviews, these are the times of when you go over this information. It's not once you hire them as an associate. Like you need to get to know this person before they actually step foot in your practice and start working on your patients. Is knowing what their style is, clinical style on diagnosis, and making sure their chair side manner, what they agree with and not agree with. To give them a set of x-rays. It might sound a little extra, but you will start to guide them and understand like, hey, I'm going to send these over to you. What would you do on this? They're like MOD on 3, MO on 13, crown on 15, extraction, surgical, root canal on 12, like whatever it is. Like, yeah. And it lines up with exactly what you would treatment plan. You already know right there, okay, this doctor, I think, has the same idea of what I'm looking for. And then just say, hey, why did you diagnose that? Why would you do that? And I've said this in the past of asking doctors why they do this so we can understand better of like the whole dentistry process and like why we're doing certain things. Like this is the same thing we should be doing with the candidates, because then we can understand their mindset on diagnosis behind the scenes of what you're doing, what you're not doing, and why we're doing it. And then saying, okay, if you ask this doctor, he gets offended, okay, maybe that's not a good relationship that you're going to want in the practice, because you're spending so much time together and you're trying to build the practice and grow. Like if you guys are at each other's heads with disagreeing on treatment, like it's going to be really hard to grow. And that's where it's like, we'll get into this in a little bit of like team being able to support an associate, right? And agreeing with what they're doing and seeing and being able to talk to them. So like there are so many layers that are involved with this. And I feel like there's so much we can do on the forefront before we actually bring them in. And honestly, as I'm thinking about this, I think, having some sort of document that you go through, and maybe this is something that Kirk and you and I can maybe work on to give to the viewers and throw in the community, throw on our social media platforms of saying, hey, this is like the associate checklist of what we would preemptively ask them to see if they're actually just vetted to get to the next stage of like, hey, these are questions, good questions that you could ask to make sure that this associate's going to be a good fit in your practice.
Yeah, because there's nothing worse than hiring a doctor, especially if you've paid like a moving stipend and all sorts of stuff to try to get them there.
Or some headhunter, right?
Yeah.
20, 30 grand just for them to find that person.
Yeah. And it doesn't work out. Yeah, that's a really big deal. So, you want to make sure that it's as good of a fit as possible, and don't assume that it's going to get better just because you hire them.
Yeah.
Right. So you got to remember, just with your team, for the most part, I do believe that everybody starts with their best foot forward. So they're not going to get any better than that. And so if they're already
new at like fresh out of college,
yeah,
we hope that they get better. But generally speaking, yes, their best foot is going to be on their first,
yeah. Right. As far as, and I'm not talking about speed, I'm not talking about the things that you're talking about right now, but I mean, just like their personality. Did they show up early? Do they look presentable? Like that right there will tell you a lot.
True.
Already.
Yes, I agree 110%.
Let's pivot a little bit though to what you were just talking about. It kind of segues really nicely from what we talked about, where associates, from their perspective, they're not busy because the owner doc is taking all the good stuff and they're getting all the class 2s and doing all the grunt work that nobody wants to do. We take the position of filling our associate schedule first, and then my wife will do the overflow and then build her schedule after, right?
Yes.
Part of that, and a lot of people are like, oh, well, how do you do that? Because like my patients want to see me. I'm like, guys, you're not that special. There were probably 5 people out of 2,000 that refused to see anybody but my wife.
Yeah.
It was like, realistically, anybody can see these patients and they are okay with it as long as your team backs that associate.
Yeah.
So this is where, you have to talk up providers. So not only does my wife talk up the provider, like, hey, I personally suggest owner docs, you and office managers, let them do work on you. Like, so that way, and you can honestly say like, hey, they did my fillings. I think they're great. And that will also tell you if they're good as well. But no, the team also needs to be like, hey, you're going to love Dr. Smith. He's really great. You're going to love Dr. Nancy. She's really great. She's going to be able to take great care of you. If your team has that belief and that confidence in the associate, then the patient will too, and they can feel it. And if for some reason the patient's like, oh, I only want to see you, then hey, this is what you say. It's like, hey, do you trust me? Like, this is an Aladdin moment, right? It's like, do you trust me? Right? And the patient will say, well, yeah. Okay, do you trust that I'm going to hire the right people to do the best work for you? Yeah. Okay, great. Well, Dr. Smith's going to take great care of you, and he's going to be able to do that for you. Right. So as long as you, again, endorse them, overcome that objection, the majority of the time, that patient is okay with it. Unless it's like this high-end cosmetic thing that like only you can do it. Right. But if you have you and the team on board and leadership, then there's no reason why you can't fairly easily get an associate in there and start producing right off the bat.
Yeah, absolutely. How do we navigate now, Kirk? I'm going to dive into the deep end of the struggles here. How do we navigate when there is that synchrony like is off, like not meshing with the team or not messing with the owner? Like, how do we navigate getting that associate or the owner on the same page? So let's start with, more of just like, getting the associate on the page.
So
do the other side here in a minute.
So I'm always a proponent of doing the work on the front end. So get as much done on the front end as possible, so that way it gets easier and easier, not staying hard all the time, right? So it may be a little harder just for a little bit, but it does get easier. And as long as I'm seeing forward progress, I'm okay with that, right? And it may be slower, it may be faster, but as long as there's progress, it's good. Something that we do is like to really dial in the associate for the first few months is, we have our morning huddle, but at the end of the day, we have kind of like a 10 or 15 minute huddle with just the associate and the owner doc and the assistants to be like, okay, what went well? What can we do better? And, what is a solution, not a complaint, but a solution to actually do better tomorrow. So if you can get that 1% better every single day, then it just continually gets better. And this is where it's important to have open lines of communication with your team and them be willing, and because you're so open, them be willing to give you honest feedback. And as long as the associate is open to learning and to changing and adjusting, then it works out. But again, that's where, as long as I'm seeing forward momentum, then I'm okay. Once I start seeing a lack of progress, that's where I'm starting to look at the associate and I'm like, hey, we need to talk. I'm not seeing this growth, and this is what has to happen.
Absolutely. I think the openness on it all comes down to communication. Everything that we're building and growing, especially relationships, all that, like, it is communication. Lack thereof ends up destroying, because one person thinks one thing, another person thinks another thing, and then we start assuming, and we know what that turns into. I guess the way, when we're talking about having an associate be open to this, we also have to be able to talk to them in a manner of saying, this is a non-negotiable of you being able to have feedback coming back and forth. And it's not that you're doing a bad job. It's not that we don't appreciate you, but like setting that up from the beginning of them understanding why we're doing it the way we're doing it in order for the team. Because if nobody ever speaks up, it's just going to be a downward trend the entire time until you start having team members quit and leaving the practice, because they're going to hate what they do. They're not going to enjoy being where they're at. They're not going to feel like they're empowered enough to say something because they're going to be reprimanded or whatnot. So you definitely have to set that up on the forefront for your team and for your associate. Like, we flip it on the other way, for them to step up and say, hey, this is what I need. Giving them the ability to say, I need these things, but then having either the office manager or somebody else handling those, so they can still be an associate, but they don't have to handle the nuances of like, hey, my assistant's never set up. Like, I've let them know, but like, I need you to reinforce me. So we also need to be able to do that on the back end for our associates to feel that they have the support also. Kirk, what do you suggest for not struggling with associate? How do you approach the whole financials with the associate? Like, how often do you run through like what they're doing for production and collections for the month, how they're doing with new patient load? Like, how often do you suggest going over that with your associates? Because I feel like there's a lot of doctors that just never go over any of this with them. And they're in the blind. So being able to use these metrics to show, hey, this is what the growth is, this is where we're going, this is where we're struggling, talking about case acceptance, things like that.
Oh man, you hit case acceptance. I was going to go there too. So, okay. So As far as the finances go, this is a conversation I had the first couple weeks. I just let them get wet. Like I don't like try to, because it's gonna be a fire hydrant for the first couple weeks. So I just let them kind of sit and get settled. But after that, I typically will have a call, and I will typically say the same thing that I do to any owner doc. Is like, hey, how much do you want to bring home? What do you actually want to do with your personal life, so that way you can have that here? Because honestly, if they can't hit their personal goals at your office, they're not going to stay either way.
Yeah.
So I typically will go with like, okay, cool. How much do you want to bring home? And they'll be like, okay, 300,000. Like, okay, cool. Well, based off your contract, in order to do that, let's reverse engineer these numbers. That means you have to produce, let's just throw out a number, 6,500 a day.
Yeah.
Right. In order to have 32% of collections hit that number daily, in order for you to hit that 300,000 a year.
Yeah.
Right. So then they have a number. They have a number to focus on. Right. Then we start looking at case acceptance or treatment acceptance and the dollars that are being accepted, and we look at that. But still, we've got to know what the goal is. Like, then we can look at it, how it pertains to the actual practice goal, and see if that even is a good fit too.
Yeah.
Right. But if you can simply have that small conversation with them after the first couple of weeks, like, hey, how much do you want to do? Cool. Well, this is what you got to do in order to do it. That means you need to do 3 crowns a day, a handful of fillings, and an extraction and an emergency a day, plus hygiene. Then you're good. Right. And like, show them the path, because honestly, most of the time they don't know the path. Yeah. Even a number isn't enough. So, you have to be able to show them the path, give them the resources to be successful, and then show them where these bottlenecks are that are preventing them from doing that. Yeah. Which one of the biggest ones, like we just noted on, is treatment acceptance, right? Yeah. So, typically the treatment acceptance for an associate coming in that I've seen on average is anywhere from 40 to 50%. It's going to be average. It's not going to be very high, whereas I want the acceptance to be 80%. So if we present a treatment plan, I want that person walking out with something scheduled at least 8 out of 10 times. Most of the time, this is what I hear from associates when they're treatment planning is, here's what I see on the x-ray. Here's what I see in the picture. I think it may be a crown. Mm-hmm. So we're probably going to need to get that scheduled pretty soon. It's up to you. That's typically what I hear, which sounds super duper not confident whatsoever. So what I tend to try to do is even with normal, like, owner docs and treatment coordinators, flip that verdict. Yeah. Start with the actual problem. Mm-hmm. So like, or the solution. Hey, you need a crown on this tooth, and here's the reason why, and use the x-rays and the pictures to back it up with facts. Yep. Versus ramping up with dental jargon that confuses the patient already. And by the time you drop the bomb of bad news, they're not ready to hear it either way. Yeah. So you're going to see, like, from what I see anyway, when you flip that script right there and start with the verdict, then you're going to see an extra 15 to 20% increase in your acceptance.
I love that. Thank you for diving into that, Kirk. The other thing that I've done with my doctors, I was very forward on and a little bit more aggressive, is like, are you happy with your income right now? Are you making enough money? And you'd be surprised. Sometimes they're like, man, I'm doing better than I've ever done. Like, are you making more money than you were, right, from the previous office? So they're like, no, that should be a red flag quick. Like, you need to correct that because they just switched jobs and they're making less money. Maybe if they're on their way out in retirement and they don't care, that's different. But like most doctors if they're switching for a better opportunity. So I would constantly go like, hey, your income, like, you crushed it. Like, you set a record for the office, for yourself, or, hey, I'm noticing it's a bit behind, because what your associates start seeing is saying, hey, they're actually looking at what actually hits my bottom line, and they're caring about that. Give the big cases to your associates as long as they can handle it, right? If there's like a full arch case and they've never done full arch before, don't be tossing them to them and hoping for the best. Like, make sure that you're tossing the things that your associates are really good at. But like, one thing I think is the biggest miss, Kirk, and it pisses me off, is dentists are like, oh, that was a $30,000 cash case. Like, I want that in my office. I'm like, okay, yeah, but if they do it, you're still making your money, and then your schedule's free to produce too. Like, and your associate's going to be super stoked. Like, you're still making money. So like, stop being selfish with these cases, stop being ignorant with it, and like, empower your associates, because they're going to end up producing so much more in that manner rather than just being a douche and keeping everything to yourself.
In getting to this harmony, right? So if we can be generous from the ownership side, then put confidence in the team to the associate. But then on the associate side, guys, if you can simply come to the table being open to change and being open to adjustment and being open to constructive criticism and getting better, then it works really well. Now, is it going to be perfect? No, it's going to be rocky, but you can get to a place of harmony.
Yeah.
Versus just kind of, okay, yeah, I'm just going to throw you into the deep end and good luck from the ownership side. And then the team doesn't have any confidence in the associate. You're just being thrown all the random stuff. And then the associate's not making money. They're not happy to be able to support their family. It just doesn't work that way.
It doesn't. There's two things that we talk about with business, at least I do with some of my ventures I'm in. And the first thing is, don't be greedy.
Yeah.
And the second is, no egos. And those are two things that you really need to establish from the very beginning, because if you can't establish that or break through that barrier, you're going to have a lot of problems. And it's like, if nobody's greedy and we're all looking out for the best of each other, in turn, typically you will have a lot more gain to have from that. And then same with the egos, is like, just remove yourself and be okay to hear feedback. Yeah. Like, we have to be okay with that. And a lot of these dentists, well, I've been doing it for 40 years. I don't care.
Yeah.
Like, quite honestly, like, anytime somebody says that to me, I'm like, I don't even want to work with you. Like, I don't even want to talk to you, because you're too full of it in yourself. Kirk and I could tell Kirk something, he'd be like, yeah, you're probably right, or hey, I respectfully disagree. Like, we can give each other feedback without feeling defeated or like our ego's been stomped on, because there is none. Like, there's no need for that. And I think owner docs, like, you really need to go in, like, there's a difference between being confident in your experience and having an ego. There's total difference. There's confidence and ego do not play in the same court. It's what you do with that confidence that will drive into the egotistical kind of platform. But there's too many dentists I've seen, even as before I was in any of this, and as a dental tech, I got to see so many different personalities of dentists coming in, like, I know what I'm doing, don't need your help. Perfect, have a good day, see you later. Or, hey, is this what I should be doing? Like, yeah, that's what I would do, or I would try this. Like, asking for feedback, knowing what the right thing is to do, but still saying, hey, am I going the right direction? Like, it's okay. There's nothing to say you don't know what you're doing if you ask questions.
Yes.
That's where I get into, owners really think long and hard about how you treat your associates, how often you communicate these things with them, because that's where you're going to breach that 18-month mark. And there's associates at my old practice before I started, and they're still currently there, which is breaching almost 7 years of associateship, which breaks all the barriers of what says it should be. So super cool to see that there.
Yeah. Well, guys, it's been another great episode. I know you've gotten some value from this. If you have more questions about associates, about how to integrate them, when to integrate them, when not to integrate them, let us know. Hit us on the YouTubes, like, subscribe, leave us 5 stars, and let us know what you want to hear. But make sure you hit Dental Office Management Leadership Network, me on Instagram at Kirk Teach Out. But we will talk to you later. See you.
Till next time.
Come on, give me some. Yeah.